Hello students, today we will deal with the topic known as migraine or also called as migraine headache. The migraine is the word comes from Greek word name hemicrania, that means one side of the head. In the migraine usually there will be one sided headache or unilateral headache, and that's why the word hemicrania means one side of the head. So what is the definition of migraine? The migraine means episodic neurovascular phenomenon characterized by unilateral headache. Okay, even the neural and vessels, blood vessels, are also included in the migraine, and it is one sided, so unilateral headache. So what happens here, there will be initially vasoconstriction, and later there will be vasodilatation. Okay, vasodilatation, and because of vasodilatation there will be throbbing headache. Okay, throbbing headache will be there, and that is a in the one side. Okay, that is due to vasodilation. So as I told, there will be vasoconstriction first and later vasodilation. Okay, and if we see, there is a huge cases are present in the female than male. Okay, females are more affected than the males. And the basic types of migraine is without aura and with aura. First, let's see what is without aura. Okay, without aura, it is most common type of migraine, and it attacks. There will be more than 5 attacks lasting for 42 to 72 hours with both of the features, like there will be nausea, vomiting, photophobia, that is uh, difficulty in seeing the light, we can say. Okay, there will be fear of light, it is known. And phonophobia, there will be uh, a fear to the sound. Phono means sound. Okay, that is in the one feature. And the other is there will be more than or equal to two of the following, that is unilateral headache, pulsating, that is pulsating, pulsating, and this is aggravated by the routine activity. So these are the features are present in the without aura type of migraine. And what is with aura migraine? There will be more than two attack with these symptoms. Like there will be aura, visual aura and sensory aura. Visual aura, there will be light variation in the light, and even the sensory perceptions will be altered. There will be unilateral progression of signs and symptoms over more than 5 minutes but less than 60 minutes. It will not go beyond 60 minutes. And if the aura present within 60 minutes, you will have the headache. Okay, if any aura is present, visual or a sensory or sound, any aura is present within 60 minutes, you will have the headache. Okay, that is what about the without aura and with aura type of migraine. So what is aura? Okay, it is not like a current trend aura where you are having some kind of energy or some power or some uh, just like cool method. Okay, so here aura means it is like a neurological symptoms where more than one fully reversible symptom is present. Okay, these are the fully reversible, but more than one symptoms will be present, like visual changes, flickering spots, like light spots will be available, and visual loss in the vision field. One spot will be present where you cannot see the any object in that spot, like small spots. Okay, this is the vision area. uh, Here it will be darker. Okay, you cannot see anything here. See? That is the visual loss. And there will be sensory symptoms like paresthesia. You will be having the numbness also with the paresthesia. Paresthesia means it is a combination of numbness and tingling sensation. Okay, and there will be alone numbness too. There will be speech disturbance. You will have a anger. Okay, uh, like a patient with migraine, you cannot talk to them. They will be having a so much of anger, they may beat you also. Okay, so what are the triggers of migraine? Okay, here even the patient themselves will tell that they are having these triggers. When they eat chocolate, after some time they will have the migraine, or cheese, hunger, irregular sleep if they are not sleeping properly, and even after the alcohol drink, and after eating some of the food, most specifically spicy foods, after eating these, they will be having the migraine. If the patient themselves will tell these symptoms or these triggers. So, what are the major types of migraine? That time we have seen the minor types or a basic types of migraine like without aura and with aura. That is like a features. But now we are seeing what are the types of migraine. Okay, those are, first one is hemiplegic migraine. Okay, hemiplegic migraine means there will be profound hemiplegia, one-sided sensory loss, and even the motor activity cannot be done in that part, and it precedes the development of headache by 30 to 60 minutes. Before the headache you will be having this hemiplegia, profound hemiplegia, that is hemiplegic migraine. And next one is basilar migraine. Here, brainstem disturbance with impaired consciousness will be present. Along with that, there will be vertigo, dysarthria, and diplopia. You cannot see, I mean, you cannot walk, you cannot talk. You will be having the double vision. You'll be having dizziness like symptoms. Your consciousness will be altered. So these are the types, like features in the basilar migraine. So the third type is ophthalmoplegic migraine. Here the patient will be having the ophthalmoplegia, like uh, he is losing the motor and sensory function of the, not usually sensory but motor function of the ophthalmological related muscles. Along with ptosis, there will be like drooping eyelids. It's like a lazy eye. You will see like a lazy eye. That is called as ptosis. This is the third type. The fourth and last type is acephalgic migraine. Here, neurologic deficits without the headache. Okay, here there will be no headache, but other neurological deficits will be there, like impaired consciousness, vertigo, or motor function loss. But it is of for some time only. It is reversible with the medicine or without medicines too. So, what are the treatment of migraine? You will give simple analgesia like paracetamol 1 gram per oral, uh, or soluble aspirin. Okay, or soluble aspirin from 600 to 900 mg, depends on the patient, per oral, or an NSAID also can be given. NSAID is, what are the NSAIDs or any example, you can just comment the drug name below. NSAIDs are non-steroidal anti-inflammatory drugs. And along with this, you have to give 5-HT1 agonist like sumatriptan, that is 50 to 100 mg per oral medicines are available, or 6 milligram subcutaneous also can be given. This, what sumatriptan does is causes the vasoconstriction. Due to vasodilatation, as I told before, there will be throbbing headache. So what you will give is the sumatriptan, which will cause the vasoconstriction. But you should have a knowledge that oral triptan cannot be given for the patient below 18 years, but for 12 to 17 years you can give the nasal triptans. Okay, oral triptan cannot be given, but nasal triptan given for only 12 to 17-year patients. Okay, uh, for which and all conditions or patient this sumatriptan is or 5-HT1 drugs are cannot be given is ischemic heart disease. Why? Already his heart is in the uh, like final condition. Ischemia is happening, blood supply is not happening, and upon that if you give sumatriptan, what will happen? There will be again vasoconstriction and he may undergo heart attack or he may die. Okay, and uncontrolled hypertension. In the hypertension, what happens? Already blood vessels are vasoconstricted. So upon if you give vasoconstriction, again hypertension will increase. And basilar and hemiplegic migraine, again you cannot give sumatriptan in case of basilar hemiplegic migraine. For that, other medication can be given, as said in the above, like paracetamol or NSAIDs can be given. And again, prior stroke. In the stroke, again already the blood vessels are constricted, blocked or died. Again, if you give vasoconstriction, there will be a further stroke again. Okay, so stroke patient cannot be given with the sumatriptan. And after giving the triptan, you should observe that at least 45% of the patient will have a throbbing headache again within 2 hours after giving the triptan. That is like a rebound headache. Again, the headache will come. What you should do, you should give a second dose of triptan here. Okay, if the patient is having rebound headache, you should give the second dose of triptan. So what are the other medications you can give is metoclopramide is an antiemetic. 10 mg per oral or IV can be given, but avoid ergotamines and opioids. That is very important. You should not give ergotamines and opioids to the migraine patients. And if there is a condition like altered mental status or neurological signs, immediately shift to the referral hospitals and you admit them. Okay, and what are the prophylaxis? You can give valproic acid, beta blocker. In the first line we have propranolol, or topiramate also can be given. This is a prophylactic medicines to control it. Okay, so that's all about the migraine. We'll see you in the next class. Thank you.